Dr. Troy Randall is a board certified cardiologist at Virtual Cardiology in New Jersey. He is also the program director of the Cardiology Fellowship at Virtual Rowan University School of Osteopathic Medicine. Dr. Randall has received honors and recognition as a South Jersey top doc and was awarded the Rowan School of Osteopathic Medicine Alumnus of the Year Award in 2023. Let's give it up for Dr. Troy Randall.
As he mentioned, I'm a cardiologist from New Jersey, and I feel like I have a tough task ahead of me following some of these stories. Being a physician on a panel and just hearing some of the patient testimonies is very powerful. And one of the things I would like to emphasize as a doctor is when I have patients come to talk to me, it's not a dictatorship, right? So it's not because I'm the doctor, you do what I say, right? We're a team, right? So we work together, and part of that is having a relationship with someone you trust, as well as someone that's listening to you. Today we're going to talk about atrial fibrillation, which is a common heart arrhythmia. If you have some questions at the end, I'll gladly support that. I'm being sponsored by Boston Scientific, who has the Watchman device, which I will talk about as well. And it's a part of the treatment that we have for people with atrial fibrillation. Part of what we will discuss in this session will be, one, how the heart works, then two, what is atrial fibrillation, and why is atrial fibrillation important? So atrial fibrillation is important because it puts you at high risk of stroke. And then what do we have as options to treat this? And then at the end, there'll be a list of some educational resources for you. So I'll talk, and then if there's any issues at all, let me know. As I mentioned, I'm from New Jersey. We're a team. I want to thank you all for being here. And it's great to see the number of people that are investing in their health and what Black Health Matters is doing for outreach, because part of us getting healthy is understanding, right? And part of my job as a physician is not only to help take care of you, but also to educate you, right? Because if you don't know, you can't do anything about it. And prevention is key. One of the things that we will kind of see when we talk about healthcare and all, it's a struggle, and there's healthcare disparities. I feel that we in our culture are not being taken care of quite the same. And there's a number of reasons for that, which I will get into a little bit later. All right, so let's jump into atrial fibrillation. If I'm going too quickly, I can answer questions at the end. I know we're a little bit behind, so I'll try to make sure that I address everything in this. But some of this I may talk through quickly, but again, at the end, if there's any questions, you can always reach out to me. So how does the heart work? So basically, the heart has 4 chambers, 2 at the top, 2 at the bottom, 2 on the left and 2 on the right. So blood comes into the heart on the right side, and it's the top chamber, then goes into the bottom chamber on the right, then goes into the lungs to get oxygen, then goes into the left chamber at the top, the left chamber at the bottom, which is the workhorse that sends the blood to the body. And if you look at the diagram in that top chamber on the left, you see a little pocket. And that pocket is what we call that left atrial appendage. And that's going to be key as I move forward and talk to you about atrial fibrillation. Atrial fibrillation is an irregular heart rhythm. Normally, the heart beats because it has a powerhouse signal that starts at the top, sends the signal down to the bottom of the heart. In atrial fibrillation, the top part of the heart has multiple areas that are sending these signals. So the top part of the heart is beating erratically, is beating fast, and this heart rhythm can get somewhat out of control. Very big disease process. Over 10 million people in 2020 with atrial fibrillation, and anticipated to grow as we move into the next decade. And the types of atrial fibrillation, we categorize it. So we have paroxysmal atrial fibrillation. And paroxysmal atrial fibrillation go in and out of atrial fibrillation. So you're not always in this irregular heart rhythm. Sometimes you're in a normal heart rhythm, then sometimes you go into this irregular heart rhythm. In persistent atrial fibrillation, it lasts a little longer, generally less than a week, and you can kind of go in and out of it as well. Generally, you need therapy to go back into a normal heart rhythm. But if you don't take care of that, that can lead to permanent atrial fibrillation. And permanent atrial fibrillation, basically, you stay in for the rest of your life. The big causes of atrial fibrillation: high blood pressure, heart disease, lung disease, thyroid disease, different stimulants, alcohol, sleep apnea. Those are the biggest things that cause atrial fibrillation. And when we talk about heart disease, we have a big audience here. Within our community, 1 out of 2 of us will have hypertension or heart disease, which potentially puts us at risk for atrial fibrillation. So almost half of this room will have high blood pressure leading to heart disease. And one of the things when we talk about heart disease as well is we're living longer because we got better at treating other disease processes. We're better at treating diabetes. We're better at treating cancer. We're better at treating HIV. So we have people living longer. So as you live longer, eventually you end up having heart disease. When we talk about these illnesses, it's not always fatality or death that's concerning. When we talk about disease process, we all worry, is this going to kill us? I think that we kind of don't pay enough attention to disability and how disabling these disease processes can be. So not necessarily kill you, but leave you where you're not as functional. And that's very important to realize the disability that factors into this. What do you feel when you're in atrial fibrillation? Most commonly, people may feel palpitations, feel like their heart's fluttering. Sometimes you may feel short of breath. Sometimes you just may feel tired. You just don't feel yourself. When people say that you heard of these testimonials, listen to your body. Listen to your body. Your body's telling you that something's wrong. Even though you may not know exactly what it is, you're not yourself. Sometimes you just may not feel anything. We have a fair number of people that have atrial fibrillation that actually don't have any symptoms at all. They don't know that they're in atrial fibrillation, they're functioning. And part of it is because they're functioning, they're pushing through. And then if they come early enough where we put them back into a normal sinus rhythm, normal heart rhythm, and then they start to pay attention to their body, then they will know, because the energy level that they didn't think was down, they know that the energy level is back. So I think you have to be mindful and pay attention to your body to understand the signs and symptoms. In our community, and part of why I'm here, I'm passionate about the education and addressing healthcare disparities, is because with multiple disease processes, we just don't get the same therapy. And when we look at atrial fibrillation, we're 2 times more likely to have it compared to our white and Caucasian counterparts, but we're not being treated the same. The therapy options aren't the same. And why is that? And that's part of the reason why I went into medicine, is to try to impact our community. And sometimes there's a bias, right? So sometimes there's a bias because we think that maybe you're not going to follow the game plan that I lay out to you. And some of that could just be the interaction that we have, right? You may come across like with body language that they just don't understand, right? And so we create this intrinsic bias. Some of it is also on you, right? Because you have a bias towards healthcare, right? Sometimes you may not go and seek health care early enough because you're afraid. Sometimes, you may not want the medical therapy that's being put out there for you. Some of it is institutional wise. Some of it is the insurance, right? So the access to care. There's different levels of insurance coverage, right? So someone that doesn't have as great of an insurance plan doesn't necessarily get the same options as somebody that has a better insurance plan, right? So this happens because there's multiple things in our healthcare system that is actually broken. But again, as a team, when we talk about working together, I think that that's how we kind of overcome this. Atrial fibrillation puts you at the risk of having a stroke 5 times more than not having it at all. And what happens with that? So when I talked about that heart not beating irregularly, about the heart beating irregularly, not beating normal, in that pocket, blood clots can form in there. And if that blood clot leaves the heart, it goes to the brain and causes a stroke. The other thing that happens with atrial fibrillation is because the heart's not beating normally, it's beating fast and irregular. Over time, if we don't slow the heart down and get it back into a controlled rate, it puts you at risk of heart failure. And I use running as an example. If I asked you to go sprint, when you first start, you have energy. This morning, everybody's very, very energetic, working out, doing it. But if I don't let you take a break, at some point in time, you get tired. And the heart's the same way. The heart's a muscle. If you don't let the heart take a break and do what it's supposed to do, it gets tired. And it puts you at risk of having heart failure. And that's where you get that risk of stroke. So that pocket that I was showing you earlier, and that top left-hand part of the heart, that left atrium, that's where those blood clots form. And if it leaves there, it goes up to the brain and causes a stroke because it's blocking the blood supply there. So what do we do about that? We want to make sure, one, we control the heart rate, but two, we want to decrease your risk of stroke because most of the people that have strokes from blood clots in the heart, 90% of the time it comes from atrial fibrillation. So there's other reasons, but the most common cause is this atrial fibrillation. And you want to be able to recognize when you're having a stroke. And one of the acronyms for doing that is be fast, right? So B, balance. Your balance is off. You may feel a little dizzy. E, eyes, blurred vision. F, face, facial droop. You may see one side of your face drooping more so than the other. A for arms. You get weakness in your arms and your legs. S for speech. Your speech is not quite the same. You're slurring. And then T is for time. You notice any of those things I said before? Call 911 because time is the key, right? So the longer you wait, the more damage is done. So you want to be able to act quickly as possible. What are our treatment options? So the first thing that we do if you get diagnosed with atrial fibrillation is we want to be able to manage the atrial fibrillation. So we manage that with controlling the heart rate. Sometimes we'll try to put the heart back into a normal heart rhythm. Atrial fibrillation itself is not life-threatening as long as we manage it. It's, if we don't take care of it, the other risk. So the risk of having a stroke. So if I don't mitigate your risk of having a stroke with blood thinners or a left atrial appendage occlusion device, you potentially have a stroke. If I don't manage the heart rate, you potentially go into heart failure. So the biggest key is management. And we manage it by, again, slowing the heart rate down, controlling it. We can control the heart rhythm, try to put you back into a normal heart rhythm. We either do that by medication. We can shock the heart back into a normal heart rhythm, which we call cardioversion. We could do other procedures such as an ablation, where we put catheters into the heart. And if we put catheters into the heart, we burn the areas that send in all of these erratic wild signals. So those are things that we can do as providers. But then the other thing that you can do is making those lifestyle changes, right? So we have to identify what was it that triggered the atrial fibrillation in the first place. If it was sleep apnea, make sure you're controlling your sleep apnea, wearing your CPAP. If it's hypertension, we got to control the blood pressure. Diet, you want to have a heart-healthy diet. Avoid alcohol, exercise. We were getting going this morning. I think we have another session this afternoon. Goal cardio is at least 150 minutes a week. 30 minutes 5 days a week, 50 minutes 3 days a week. So those lifestyle changes that we can make are going to be huge. And then we want to reduce the risk of stroke. More commonly, we use medications. And then the other option is using a left atrial appendage occlusion device, such as Watchman. The blood thinners that we use to control decrease your risk of having a stroke. Coumadin, older, very cheap, but you have to get blood work done routinely because your levels need to be in a certain range. Certain foods that you eat may affect that. Certain medicines that you take may affect that. But again, I think the key thing I said earlier with that, very cheap. So most commonly, if we end up with atrial fibrillation, you may see a large disparity of us on Coumadin, which is not quite preferred anymore for those other reasons that I mentioned. There's also aspirin, which is not quite as effective. But the other medications that are out there, and you've probably seen commercials for them, Eliquis, Xarelto, those are newer medications, more expensive. So it depends on, again, your insurance coverage, right? And so because of that expense, some of us may not necessarily be able to afford them. Although the studies show that we generally do better with these medications than we do Coumadin. So that's part of our healthcare disparities that we have there as well. And then the other thing that you want to do is see what is your risk of having a bleed. So the blood thinners are here to decrease our risk of having a stroke, but what's my risk of having a bleed? And what's my lifestyle like? And that's where the advantage of a left atrial appendage closure device comes in, such as the Watchman. And basically, what this does is we go into the heart with a catheter. We go into your vessel. We have this closure device at the end of the catheter, and we plug that pocket that I was telling you about. And once we plug the pocket, tissue grows around it. It becomes a permanent structure, and blood clots can't get in that pocket anymore. And what that allows is, over a period of time, you come off of your blood thinner. Some can come off of it the same day of the procedure, but 96% of the patients come off of their blood thinners within 45 days. The Watchman device is a very safe alternative to using oral blood thinners and allows you to come off of those blood thinners and decrease your risk of stroke. So when we talk about healthcare disparities, part of the reason why I bring this up is the medications that we talked about that we don't necessarily get treated with as much as others, but also procedures, right? And the procedures is twofold. One is myself as a provider may not offer you that option for whatever bias I may have, but then also I say we as a community, because of our trust factors, we don't like to necessarily have procedures done, right? We're afraid sometimes, especially of anything invasive. So the biggest thing I could say is just make sure that you're educated on what's going on. As I mentioned, 96% of patients come off their blood thinners within 45 days, all right? Very safe, minimally invasive. It's not a surgery. We go in with the catheter. I like to say it's a procedure. I think I have a little video to demonstrate exactly how it's done.
This is the Watchman implant, a one-time procedure that may reduce your stroke risk for a lifetime. If you have non-valvular atrial fibrillation, or AFib, not caused by a heart valve problem, and need an alternative to blood thinners, the Watchman implant could be right for you. AFib increases your risk of having a stroke. In fact, on average, a person with AFib is 5 times more likely to suffer a stroke than someone with a regular heartbeat. That's because AFib causes your heart to beat irregularly, which affects its ability to pump blood normally. And when the heart doesn't pump as it should, blood can collect and form clots. If a clot escapes, it can cut off blood supply to part of the brain, causing a stroke. In people with non-valvular AFib, blood clots most commonly form in an area of the heart called the left atrial appendage, or LAA. Closing the left atrial appendage is an effective way to reduce the risk of a stroke in people with non-valvular AFib. The Watchman implant fits right into the LAA, completely sealing it off so blood clots can't form there and lead to a stroke. The Watchman implant permanently reduces your stroke risk without the use of blood thinners and the worries that come with them. If you take a blood thinner, you are likely aware of the bleeding risks that come with it. Most people can take a blood thinner for years without serious side effects. But because blood thinners help prevent clots by thinning the blood, they also increase the risk of bleeding. Sometimes bleeding can be serious or even life-threatening. For instance, you may experience internal bleeding or bleeding in the brain, which can cause a stroke. If you've experienced this kind of bleeding while taking a blood thinner or think you're at risk for this kind of bleeding in the future, talk to your cardiologist about the Watchman implant. The Watchman implant procedure is safe and minimally invasive and doesn't require open heart surgery. With 20 years of clinical trial and real-world experience, including 10 clinical trials, the Watchman implant has a proven safety record. Similar to a stent procedure, your doctor makes a small cut in your upper leg and inserts a narrow tube, then guides the Watchman implant through the tube into the left atrial appendage. The procedure is done under general anesthesia. People who get the Watchman implant usually stay in the hospital for a day or less. After the procedure, your doctor will prescribe you a choice of either antiplatelets or blood thinners. During that time, your own heart tissue grows over the Watchman implant to form a barrier against blood clots until your left atrial appendage is permanently sealed off. Many people may be able to stop taking blood thinners immediately after the procedure, and in a clinical trial, 96% of people were able to stop after just 45 days. Make sure you talk to your doctor to understand the right medication for you and how long you'll be on them after your procedure. The Watchman implant is the #1 doctor-recommended left atrial appendage implant, and it can be a life-changing alternative to the daily use of blood thinners and the bleeding risks that come with them. Get your customized doctor discussion guide so you can talk with your cardiologist about whether the Watchman implant is right for you. Go to watchman.com/guide.
The Watchman has been around for over 20 years and studied, and we're probably in, I think, the third generation of it. So it's definitely improved from initially. And again, I want people to understand that it's a safe alternative to using pills as well. So good safety record there. If you have atrial fibrillation, if you're on blood thinners, you have a high bleeding risk. If you can't afford to take oral medications or the blood thinners, if you just have a lifestyle that you don't want to be on blood thinners and you have a high bleeding risk, the Watchman is for you. And talk to your doctor about it. If you have a nickel, nitinol allergy, you want to avoid it. If you can't be on aspirin, because you have to be on aspirin lifelong, so if you can't be on aspirin or blood thinners for a short period of time, you have to reconsider it. But most people, you want to have that discussion. So again, atrial fibrillation, high bleeding risk, you want to talk about your options. Rate control, rhythm control, decreasing your risk of having a stroke. When we talk about costs, blood thinners over time, again, can cost money. If you're on a cheap one, which is warfarin, you have to get blood tests all the time. We say that the Watchman device is a procedure, one cost, one time for the rest of your lifetime. So what I recommend is connect with your doctor, discuss kind of what's going on medically, and discuss your options, right? So you don't always necessarily have to do procedures when you first meet, find out about what's going on. But I think when you first find out about your diagnosis of an illness, you should know what are the options. What's the path that I'm going to have to walk down? And then you can make the decision of which path you want to walk down, right? But you need to know what those options are. Talk to other people that may have had it, family, friends, different support groups, and then look up additional resources. I heard a lot about looking up online. Dr. Google, I say, is the worst doctor around. I think the internet has a wealth of information, right? But there's also a lot of misinformation, right? So when you use the internet, you want to make sure that you're using reliable sources, right? So with that, I would say thank you for your time. Um, I like to see the community engaged in their health. And if you have any questions, I'll fill them now.
Okay. Good afternoon.
Good afternoon.
I'd like to ask this question. I've had my right valve replaced. I've had my left valve replaced. So at this time, I should talk to my cardiologist about the Watchman.
No, so you want to look to see what your heart rhythm is. So if you're in a normal heart rhythm, you don't need to watch me. All right. So you're on medications for your valves. Um, the the Watchman is for people that have atrial fibrillation or this irregular heart rhythm that puts them at risk of having a stroke. So it's an option of being treated without necessarily needing blood thinners for long term. Eliquis long term. Now the question again: is it because of the rhythm or is it because of the valve? So that's the discussion that you have to have with the doctor.
My question is, the Watchman, is that a outpatient or is that a 2-day, 3-day Medicare bill?
So it's an outpatient procedure. Um, the procedure itself depends on the operator, like who's doing it. It's been around for a while. In most cases, it's less than a half hour for the procedure. Uh, some places may require an overnight stay, even though it's a same day procedure, but in a lot of cases, you may go home the same day. But worst case scenario, unless there's a complication, it may be a one night stay in the hospital.
Hi there. I have a question. Just like breast cancer, you're supposed to check your breast and see if you have any lumps. With this atrial fibrillation, how do you check and make sure your heart is beating normal? Now, I know if you go on the treadmill and you put your hands on there and it shows a constant heartbeat and what that number is supposed to be, and then the resting heart rate. Like, how do you train people that may not know how to check that? Is it a self-check?
So I think that the biggest thing is preventive care, right? So I think that we all should be having regular visits to a primary care provider, just from prevention standpoint. And then if you have risk factors such as high blood pressure, diabetes, I do think, and not because I'm a cardiologist, but also because I am a cardiologist, I do think that you should be seeing a cardiologist because those things are putting you at higher risk of heart disease. And my goal is prevention, right? So if you're doing those things regularly, hopefully we will identify it. In today's technological society, we have smartwatches. So smartwatches to detect abnormal heart rhythms. And again, when I talked about symptoms, if you're just not feeling yourself, you want to kind of start to do a dive as to why and make sure that an irregular heart rhythm is not part of that. But we have smartwatches now that people are using and probably identifying irregular heart rhythms more than doctor visits, if I would say so myself.
Hi, I wanted to know if the Watchman can work with an ICD device, and also what is the age of a person that would be a good candidate for the Watchman? Would an elderly person around 85, would they be a good candidate for it?
Yeah, so you can have a Watchman as well as having an ICD, and age is a number, right? So um, I don't look at an age per se and have a cutoff. You have to look at functional status and quality of life, right? So an 85-year-old that is very functional, I would recommend a Watchman device. I may have a 60-year-old that can't do anything, right? And may have a poor prognosis and less than 6 months to live that I would say you may not have a benefit. So I don't look at an exact age cutoff. I look at the individual and their quality of life and functional status.
I used to take hydroxycut with ephedra, and that caused my heart to enlarge and weaken. So I'm on a Hello Heart program now, where I have to monitor my blood pressure twice a day, and occasionally it'll tell me I'm having an irregular heartbeat, and I'm not. If I refer that to the doctor, they don't see it as anything significant. So whenever I'm feeling, kind of listless or that, I take apple cider vinegar. Is apple cider vinegar good for anything at all?
Nutrition, healthcare, very key. So as a doctor, as a healthcare provider, uh, again, my job is not necessarily to push medicine, right? But we do use medicine sometimes because of the benefits of it. More importantly is lifestyle things and diet, of which vinegar does help, apple cider vinegar. It also helps in lowering blood pressure as well. So there are advantages to it, but you also have to be mindful of how you're taking it as well, because it's acidic, so it can damage your teeth, and also benefits there, but you want to make sure that you're kind of also doing all the other things on the back end. Thank you.